Before moving into the next lecture, actually we have an announcement for you. Our competition number 3 is now appearing on your screen, and please log into the link, and you can participate to our competition, and the active time is 30 minutes, and you will be given a better price, better price than previous. Okay, now the next lecture will be done. The next lecture will be on basics of valvular heart disease, and I would kindly invite Dr. Chaminda Pushpakumara, consultant cardiologist, to give you the lecture. Over to you, Chaminda.
Okay, thank you. So it's about valvular heart disease. So before getting to the valvular heart disease, just we'll get around and just to know what is heart and how the valve, where the valves are being located. So this is your heart. It's essentially a pump, and it has 4 chambers and 2 atria and 2 ventricles. So the right side has the right atrium and the right ventricle, and between the right atrium and the right ventricle, there is a valve called tricuspid valve, and when the blood flows through the right ventricle to the pulmonary circulation, it's being guarded by the pulmonary valve. When it comes to the left side of the heart, left side, the blood flows from the left atrium to the left ventricle, and that's been looked after by the mitral valve. When the left ventricle pumping the blood out of the heart, it's been looked after by the aortic valve. So there are 2 inflow valves and 2 outflow valves when we talk about the left and the right ventricular circulation. Mitral valve look after the left ventricular outflow, inflow, and the tricuspid valve look after the right ventricular inflow, and aortic and pulmonary valves look after the outflow. Heart valve disease occurs when your heart valves do not work properly the way it should be. With times, we can see the rheumatic valve disease are just falling down. At the same time, we call the degenerative valves are on the rise. And in addition, there are some emerging valve disease as well. When we compare the population with the aging, the valve disease the incidence are getting higher and higher. Out of that, mitral valve are the commonest, and the aortic valve the second most common cause for the valvular heart disease. What is valve stenosis and what is valve regurgitation? When the valves are not opening properly, we call it stenosis. But the valves are not closing properly, the valve starts leaking the blood to the backwards, we call regurgitation. So what are the causes for valve stenosis and what are the causes for valve regurgitation? Common causes are the congenital valve stenosis, the rheumatic carditis, and with aging, some calcification and the degeneration can also cause valve stenosis. When it comes to the valve regurgitation, the congenital causes also can cause valvular regurgitation and the rheumatic heart disease. Sometimes the endocarditis can destroy the heart and cause valvular regurgitation. The trauma, when it comes to the very severe chest trauma, it can destroy the heart and the heart valves and causes the regurgitation. And the senile degeneration is also cause valve degeneration. So how the patient presents with valve disease? What are the common symptoms and the signs? Sometimes your patient coming to you with chest pain, sometimes shortness of breath, sometimes they'll come with arrhythmia. They'll tell you my heart is pounding, and sometimes they'll coming with the tiredness, leg edema, coughing, and features of heart failure. Sometimes, most of the times, the initial stages of the valvular heart disease, patients are asymptomatic. When the valve disease are getting advanced, they'll develop the features of heart failure and arrhythmia, or sometimes the chest pain due to angina. What are the investigation we should do to diagnose valvular heart disease? First, after the history, the examination, the simplest test would be the ECG. The ECG is sometimes very non-specific, but sometimes it can give the clue to the possible differential diagnosis. We can diagnose chamber enlargement and arrhythmias, and sometimes coexisting ischemic heart disease. The chest X-ray, it's a cheaper investigation. It will give you the size of the heart and give the some chamber enlargement. And echocardiography is very much useful investigation when it comes to the valvular heart disease. We can identify the particular valve, the disease valve, the morphology, anatomy, possible pathology, and hemodynamic consequences due to the valvular stenosis or the regurgitation. The new diagnostic modalities like the CT and the MRI is also helpful to understand the valvular pathology and decide on the mode of the treatment, and helpful during the treatment strategy as well. Cardiac catheterization, the coronary angiogram and the cardiac catheterization will help us to understand the hemodynamic effects of the valvular heart disease, as well as we can diagnose coexisting coronary artery disease. Then we can do the bypass surgery in case the coronaries are involved during the valve repair or replacement. So what are the common valvular problems? These are mitral stenosis, mitral regurgitation, aortic stenosis, aortic regurgitation, tricuspid stenosis, and tricuspid regurgitation, and the pulmonary stenosis and the regurgitation. So we'll talk more about the mitral and the aortic pathologies, less on the other things. So what is mitral stenosis? So mitral stenosis is the one that causes stenosis of the mitral valve, and it reduces or it obstructs the mitral flow between the left atrium to left ventricle. So it's almost always rheumatic in origin. Some older patients, the senile degeneration or the calcification of the mitral valve, the annulus, can also cause mitral valve. Rarely it can be congenital. So we'll just look at this picture, the mitral stenosis. It's not only the problem with the mitral valve as well, it's a problem with the mitral valve and the related structures. We call the chordae and the papillary muscles and surrounding tissues can be involved in the mitral stenosis. So what will happen when it comes to the mitral stenosis, when the mitral valves get thickened and stenotic, so the blood can't flow freely between the atria and the ventricle, and atria has to struggle to push down the blood through this stenotic valve. So what will happen is the atria become larger and larger, and at the end, the atria become very redundant, its function become impaired. At the same time, because the ventricle has very less blood, the ventricle becomes smaller. So what will be the end results? So when the ventricles are getting less blood, cardiac output will reduce, and the patient become very fatigued, and the left ventricle becomes smaller. So and the other effect is, since the left atrium cannot pump the blood through the stenotic mitral valve, left atrial pressure will go up. That the back pressure will transmit to the pulmonary circulation and towards the right heart, and the right heart starts failing, and the patients become getting pulmonary hypertension and features of right heart failure, that is edema and the liver congestion and so on. So this is just diagrammatic representation what we have been talking about, and you can see the chest X-ray give the clue. The chest X-ray shows evidence of cardiomegaly, especially the left atrium get enlarged, and ECG can give the clues. Sometimes it can show the atrial fibrillation due to because the atria is getting enlarged and start functioning very erratically, and the ECG can give the clue to the chamber enlargement. So these are the pathophysiological effects of mitral stenosis. Since the atria is not functioning very well and the blood stagnate inside the atria, the mural thrombi or the blood clot start forming inside the atria, as well as we call the structure called left atrial appendage. This thrombus can go throughout the body through the arterial circulation and can cause strokes, sometimes myocardial infarction, kidney infarction, splenic infarction, and systemic embolization. So the symptoms we have discussed, the investigation we have discussed. So the mitral stenosis is a process. So it can start initially as a very benign cause, and it can progress. And once it's progressed to a certain extent, the patient becomes symptomatic. So these are the modes of treatment we can offer for the patient with mitral stenosis. Initially, the early days, we still see that was patient who got what is called closed surgical valvulotomy. So the surgeons have put the instruments through the incision without opening the heart fully and dilate the mitral valve. Then the patient had open heart surgery and valve replacement. As a cardiologist, what we are frequently doing the procedure called PTMC, the percutaneous mitral commissurotomy, where we insert a balloon across the mitral valve and dilate. So this is the procedure. We coming through the right side of the heart, going across the interatrial septum, and insert a balloon across the mitral valve. That balloon has a special unique behavior where we can dilate the balloon in two stages. Once we put the balloon across the mitral valve and fix the balloon in between the mitral commissurers, and once the balloon is fully dilated, we can tear the mitral commissurers. So we'll move to the mitral regurgitation. Mitral regurgitation has very complex pathophysiology. The mitral valve has affected by the various pathologies and causing the mitral regurgitation. It could be due to rheumatic valvular heart disease. It could be due to degenerative mitral valve prolapse. It can be due to dilatation of the mitral annulus, and sometimes damage to the chordae cusp due to rheumatic and the endocarditis can cause the mitral regurgitation. In addition, it's common thing that after myocardial infarction, especially the inferior myocardial infarction, we can we know the mitral valve, the papillary muscles get ischemia and causes redundant mitral valve and causing mitral regurgitation. This picture shows you the degenerative mitral valve disease. We call mitral valve prolapse, causing the mitral valve mitral regurgitation. So when it comes to the mitral regurgitation, again at the end, the cardiac output will fail because the left heart become dilated and fail at the end. So the patient will, at the end, received very little blood through the systemic circulation. At the same time, due to increased back pressure towards the right side of the heart, the pulmonary hypertension and right ventricular failure can cause. So the classification of the mitral regurgitation is two types. There's the mitral regurgitation could be due to primary mitral regurgitation, or it could be due to secondary mitral regurgitation. The primary mitral regurgitation is caused by due to problems the mitral valve itself. The secondary mitral regurgitation can happen due to problems with the heart, not purely because of the mitral valve, but due to the surrounding left ventricle or the annulus. So these are the causes for acute mitral regurgitation, and these are the causes for the chronic mitral regurgitation. Due to the interest of time, I'm just skipping the slides. So this is the pathophysiology I explained already. So what are the modes of treatment for the mitral valve disease? So the treatment could be initially medical. Once you diagnose mitral regurgitation, very early stages, we can offer the medical management with the diuretics and the beta blockers. Depending on the pathology, we can, if it's due to rheumatic carditis, we can offer penicillin prophylaxis. When it comes to the very severe symptomatic stages, we have to offer either the transcatheter treatment or the surgical treatment. So what are the modes of surgical treatment? The valve, sometimes the mitral valve can be repaired. And if the mitral annulus is getting enlarged, we can fix the annular with the annular ring. Sometimes we have to replace the mitral valve if we can't repair. So this illustrates the mitral valve repair. And sometimes very elderly gentlemen with the very severe heart failure, we can't offer the patient the valve replacement or surgical therapy because of the patient's comorbidities. In that case, we can do the percutaneous treatment. Clipping of the mitral valve is also one of the mode of treatment. Briefly, we'll go to the aortic stenosis. Aortic stenosis is also a very common problem, and the aortic valve stenosis mainly due to rheumatic and the degenerative causes, and there are congenital variety as well, where bicuspid valve causes aortic stenosis. There are so many risk factors for the aortic stenosis. Usually we initially think about the aortic valve disease is a conventionally the degenerative disease, but it also shares the common risk factors for the ischemic heart disease as well. So it's very important to treat with the statin and the modifying the coronary risk factors to prevent the people are getting the calcific aortic stenosis in their later life. So what are the treatment modes of treatment when it comes to the aortic stenosis? The asymptomatic patient you can monitor, and when it comes to the moderate to severe aortic stenosis, you can monitor the patient echocardiographically very closely. When it comes to the symptomatic aortic stenosis, we can offer the valve replacement. Now there are the aortic stenosis treatment has been very much modified with the introduction of the transcatheter valve intervention we call TAVI. We'll briefly discuss what is it and how does it done. And these are the prosthetic valves. They can be implanted through the percutaneous methods without opening the heart. We call transcatheter aortic valve replacement, TAVI or TAVR. So who are the people who been offered the TAVI? The TAVI initially used for the very high surgical risk patient, but now we can use TAVI on the intermediate surgical risk patient as well if their life expectancy is more than 12 months. Aortic regurgitation, again, it's a common problem, and when it comes to the severe, we have to offer the valve replacement. The aortic valve regurgitation can be caused by, due to various pathologies, but when it comes to severe, we have to offer the surgical valve replacement. The tricuspid stenosis, it's very rare in isolation, but can happen in combination with the rheumatic heart disease. The treatment options are balloon valvulotomy and valve replacement. Tricuspid regurgitation can be due to primarily due to valve problem, and it could be due to problems in the right heart pathology as well. At the end, when it comes to severe tricuspid regurgitation, it causes pulmonary hypertension and features of right heart failure. When it comes to the management, we can offer the medical management, valve repair, and the replacement. The pulmonary stenosis is rare. Usually it's congenital, so the balloon dilatation and the valve replacement are the mode of treatment. So to conclude, this is the summary slide. This illustrates the modes of treatment we can offer through the transcatheters without opening the heart. When it comes to the aortic valve, we can offer the transcatheter aortic valve replacement. For the mitral valve, we can offer transcatheter mitral valve replacement and mitral valve clipping procedure, and we can do the annuloplasty. The tricuspid valve, of course, we can do the annuloplasty and repair and replacement. The pulmonary valve also percutaneously we can replace the pulmonary valve. So in the interest of the time, I'll stop. Thank you.